Today, we'll hear news about FDA action in renal cell carcinoma, detecting gastric cancer with just one breath, data on cancer cost and coverage, and the final verdict on the SGR. All that and more starts right now on OncLive News Network. Hello and welcome. I'm Laura Jones. The FDA granted Cabozantinib a fast-track designation for patients with advanced renal cell carcinoma who have received one prior therapy. Cabozantinib inhibits the activity of multiple tyrosine kinase, including MET, VEGFRs, and RET. Cabozantinib is being studied in the METEOR trial, a phase 3 study that will be assessing the use of cabozantinib versus everolimus as a second or third-line therapy in individuals with metastatic renal cell carcinoma. The primary endpoint of the METEOR trial is progression-free survival, and secondary endpoints include overall survival and objective response rates. Cabozantinib is already approved in the medullary thyroid cancer setting and is being studied in multiple cancer types beyond just renal cell carcinoma. In its early stages, gastric cancer rarely causes symptoms, making it hard to detect. Due to its insidious nature, by the time most patients are diagnosed, gastric cancer will have already metastasized. Researchers from the Israel Institute of Technology reported in the journal Gut about their research for earlier detection using a breath test. They performed two types of analyses on 968 breath samples from 484 patients, including 99 previously diagnosed with gastric cancer. Gas chromatography linked to mass spectrometry was used, and from these data, they were able to identify 8 distinct breath prints. The second test, a cross-reactive nanoarray, was able to easily distinguish from these breath prints which patients had gastric cancer and which were at low and high risk for developing gastric cancer. The breath test had 92% accuracy. The researchers concluded nanoarray analysis could provide the missing non-invasive screening tool for gastric cancer and related precancerous lesions, as well as for surveillance of the latter. Breath prints have been explored before as a diagnostic tool. This research demonstrates this tool's ability to detect and monitor those at risk. Heated discussions continue about the Affordable Care Act, and one of the topics under the microscope is healthcare cost transparency. Differences in care practice can be obvious, especially if they deviate from the consensus guidelines and recommendations. Unfortunately, cost variations are not as evident and can often be hard for patients to discern. These variations exist across providers, facilities, and geographic regions. A report in Health Affairs stresses that these differences, especially for cancer treatment, may be even more pronounced based on who is paying. Using the new Medicare Provider Utilization and Payment Data Public Use File and other sources, researchers assessed physician charges, reimbursement by Medicare and large private health plans, and expected patient out-of-pocket cost for outpatient oncology care. Lead author Dr. Stacy Dusetzina from University of North Carolina explains the difference. Patients with Medicare and private insurance don't pay the sticker price of health care. They pay a discounted rate. However, uninsured patients don't have the bargaining power, or they may not try to negotiate for a better price. Uninsured cancer patients pay between 2 and 43% more than those on Medicare, and 2 to 5% more than someone with private insurance. For example, carboplatin was estimated at $26 for one infusion with Medicare, but the estimate for uninsured patients was $1,124. The charges underscore the pressure that the current system places on the people who are least able to pay. The Senate voted to pass the Sustainable Growth Reimbursement Repeal bill. The repeal comes just before a 21% cut in Medicare reimbursement was scheduled to take effect. The legislation will not only transition Medicare reimbursements to a new and permanent payment system, but will also extend the Children's Health Insurance Program for 2 additional years. Senator Ron Wyden, Senate Finance Committee ranking member, states, "This is a momentous day, and fittingly it comes as we celebrate Medicare's 50th anniversary this year. Along with others, I have worked for many years to put the flawed SGR in the junk bin of history and move to a system that rewards value and more coordinated, high-quality care. Today, finally, we have reached that point. We are crossing the victory line, and we are all better off. Next week, we will hear about the key data coming out of the American Association of Cancer Research Annual Meeting 2015. Cancer researchers from all over the world will gather in Philadelphia next week to share highlights of the latest and most exciting discoveries in every area of cancer research. From bench research to clinical trials to policy development, data from this meeting will span across dozens of cancers. We look forward to sharing some of the salient presentations and pertinent findings with you next week. And that'll do it for today. Thanks so much for watching OncLive News Network. I'm Laura Jones. We'll see you next time.